to you. I know you've only been there for a short amount of time, but no question you all are involved in several different programs over there. Can you highlight one?
I'm going to cheat, Luke. I'm going to mention two. I'm going to deep dive one. So, and I think Jonathan could identify with this, that as a department CIO, you own nothing. You're responsible for everything. And that's what I'm discovering.
We got a smile out of Jonathan.
Yeah. So, but, so I'll mention a couple of programs, but, my job's to enable the operating divisions and staff divisions to do their job. And so you look at a couple of these things, some really exciting things going on. For example, with Vid Desai, the CIO of the Food and Drug Administration, he's working some AI projects to improve our health inspection program. Some exciting things happening there with AI and how they select what should be inspected. If you go over to Andrea Norris, National Institutes of Health, she's done some fantastic work in putting together data storage solutions amongst the cloud service providers to get better rates and come up with ways to do mass storage. We're talking 170 petabytes of research information here and allow researchers to share. So, when you dig into what the operating divisions are doing, there's a lot of really great projects going on that have been going on for a while. But there is actually one that I own that has been going on for a while. I think is doing some great work, runs out of my shop, and that is associated with the risk management across the healthcare sector of the United States. And we don't, I know you think health IT, you may not think about this, but, when we talk about critical infrastructure of the United States, a lot of people think of the energy grid. But I'm sure Ryan would agree. What we really also have to think about is that IT infrastructure that keeps our hospitals, our clinics, the pharmacies all running. And so that is one of the things I take care of through two different programs. One of them is called the Health Sector Cybersecurity Coordination Center, HC3. And what this does is it goes out and analyzes threats to the public health infrastructure and develops alerts and analysis and reports so that we can let partnering institutions know about possible issues. We also go through and look at new URLs as they're published, and if they're healthcare related, we'll look to see if they're scams or they're putting out malware. Give you an example. I've got the stats right in front of me. Last week alone, we looked at about 1,400 URLs. We sent down 162 takedown notices to the internet service providers because they were dishing out nonsense. And so we partner also with the Office of the Inspector General so that when there are data breaches, we assist with sending out victim notifications. Like last week, there were 5 of them sent out for issues that happened across the sector. Additional program we run is one that is really effective is a government industry partnership program. It's called the 405D program. That's because of the statute. It's a section of it. But we've got over 230 industry leaders that represent over 1,000 hospitals, clinics, pharmacies, you name it, that participate in this. And we work together to develop guides, procedures, things like that to enhance the security of the healthcare infrastructure. And so the primary product, and you can go out and look at this, you can go to hc3.gov, the 405D .gov is also out there. You can look, there's a guide called the Health Industry Cybersecurity Practices Guide, which my staff affectionately pronounces Hiccup. But that guide has been cited and used all over the place. In the last 12 months on social media, we've done 450 posts, kind of broadcast the procedures and best practices, received 400,000 hits on it, 370,000 were this year alone. The program's just gained interest and is starting to roll even stronger and stronger. We're working with OMB, working with the White House on improving this cybersecurity across the healthcare sector. So I think this program is having a true, real effect on security. And I think there's a lot of exciting things that are going to continue to happen. And of course, we're partnering with ONC. So, Ryan knows all about this, but just lots of good things happening there, Luke.